Bismillahir Rahmanir Rahim. I'm Dr. Mohibullah Wazir, and today we discuss the different methods or different ways in which the muscles contract. One method, one way in which the muscle contract, that is reflex contraction. Reflex contraction is the contraction of the muscle in response to some reflex. For example, we do the knee jerk or the elbow jerk, and for clinical examination, we hit at the tendon and the leg just move reflexly. This is or the contraction of diaphragm continuously. This is called as reflex contraction. Then the second type of contraction is the tonic contraction. Tonic contraction is the contraction in which the muscle remains partially contracted, and this partially contracted contraction of the muscle in which the muscle is not fully contracted, it do not produce any movement, but it remains partially contracted, and this is especially important for maintenance of the body posture. For example, if this muscle gets relaxed fully, the neck will fall. This muscle is partially contracted, this muscle is partially contracted, it did not produce either movement on this side, neither on this side, but they keep the neck in a straight position. In this way, the whole body posture is being maintained because of the tonic or partial contraction of the muscles, and that is also called as muscle tone, and this is very important for the maintenance of the body posture. If in sleep or in unconscious condition, this tone of the muscle is lost and then the limbs become flaccid. This tonic contraction or tone of the muscle I have explained in detail in my lecture number 2 of the muscles. And then the third type of contraction is the phasic contraction. Phasic contraction is that type of contraction in which there is active and willful. It is active and willful contraction of the muscle to produce any movement. And this is then divided into three types. Number one, isotonic and isometric and eccentric. Isotonic is the contraction of the muscle in which the muscle shorten in length and produce movement. For example, this movement, also called as concentric contraction. And then isometric contraction is that contraction in which the muscle is contracted but it do not shorten in length. For example, you just keep this weight in the limb and do not allow the limb to fall down, but only keep, so the muscle remains contracted but do not shorten in length to produce any movement. Such type of contraction is isometric contraction. This is important. For example, in muscle fixation or in synergistic effect, the muscle contract isometrically. They do not produce any movement but stabilize some joint. And then the third type of contraction is called as the eccentric contraction, in which the muscle remains contracted but slowly increasing in length. For example, putting a glass back from drinking water. After drinking water, when you want to put glass backward, then the biceps at this very time remains contracted but slowly increasing in length, so that to allow your hand to put the glass comfortably on the table. If the bicep it doesn't contract eccentrically this very time, then the hand under the effect of the gravity will fall and will hit the glass. This is the eccentric contraction. This also I have explained in my lecture number 2 of the muscle. This is the different ways of contraction of the muscles. Thank you very much.